Hello, everyone. Yeah, this is Sandra. Yeah, subscribe to my channel. Yeah, Sandra Yaa, YouTube.com. Yeah, subscribe to my channel so you can see all my videos. Okay, today I'm going to talk about why is it that healthcare workers don't get paid much. Why is the healthcare workers they don't pay much? They don't get paid much. Especially the carers. Caring job is the most difficult job to do. I used to be a carer. I changed my profession. But I used to be a carer. I was a carer for about 13 years. Yeah, I love the job, to be honest. And there's a saying that to be a carer or to be a healthcare worker, you shouldn't think about the money, but you need the money, isn't it? You need the money. Or else how are you going to live your living if you can't work for charity? There's nobody who said I'm working for charity, but care job is very hard. It's the most hardest job on earth. It's like somebody that has led their lives and they get old and you have to take care of them. It's not easy. And all the process that is in it, it's not easy at all. You have to do personal care for them. Some of them you have to feed them. Some of them you have to take them out. You know, and even the residents, they are not easy to deal with. Some of them are aggressive. Some of them have got dementia. Some of them have got challenging behaviors. It's hard. So I think government should do something about it. Because carers pay is very, very low, to be honest with you. It's very low. Up to now, care job, when you are working as a carer, unless you work for agency, I don't know why agency seems to pay more than original care homes. Agency, when you work for the agency, they're able to pay you more. you know but if you go to a care home or a hospital to go and work, your wages is very small, and you have to do some overtime. I mean, when it comes to overtime, there's so much overtime there that you can work as long as 100 hours, but then the tax also will take all. So I think government should do something about it, because care job is very hard job. It's a very, very hard job. It's not easy job at all. If you have not been a carer before, you wouldn't know. But if you're a carer, you know what I'm talking about. It's a hard job, and yet when you get paid very small amount, some pay £7.50 at this age, at this time that we are in. Some people are paying £7.50 for a carer. Some people to £8.50. Which I feel carers should get high pay. Whereas when you work for agency, you can get as much as £14 an hour. So what is the difference? Why is it that they are getting more and the care homes itself, they are not paying much, especially the private care homes? That one is even worse. They don't pay much at all, but yet they put so much work on you to do. They put so much work on you to do. Sometimes you get fed up, and the residents too doesn't help. Some of them it's full of abuse. They abuse you, but you still have to do the job because you need money, isn't it? Yeah. So I'm just saying that the government should do something about it. That they should try to increase the pay of carers and healthcare workers, nurses, doctors, everybody. They should increase their pay, because that the jobs that we are doing is very, very important. The jobs that they are doing is very important. They're taking care of human beings. But yet the wages they get, they don't get appreciated for it. You understand what I mean? Yes, I feel like government should look at it. Some time ago, they were saying in the news that the government said they will increase the wages, but that's what we heard. But they haven't done anything about it, isn't it? Because when this COVID came, the amount of carers that got the illness, even some of them died. Some nurses died, to be honest. There was a pregnant nurse who was in the hospital looting. She died because of the COVID, you know. Yeah, so it's like working in the healthcare is a very hard job, you know, very, very hard job. You know, you are delegating all your life into the job, but yet you get peanuts. You know, they pay you very small amount. But a job that is not all that well or good, you are getting more pay. Yeah, that's what I don't understand. You know, some jobs, in like, you'll be surprised that the amount of wages they get compared to healthcare jobs. You know, so healthcare, the government should do something about it. They should pay more to workers, so the workers will be happy to also do their job. You know, yeah, but I love being. I was very happy when I was a carer. To be honest, I was so happy with the job. You know, yeah. By the time it came that after I graduated, I had to get a job, a new job. You know, yeah, because but to be honest with you, I love the job. You know, I love taking care of the elderly. You know, taking care of the people that can't do things for themselves. You know, yeah. But the time comes, you have to move on in life, innit? Yeah. But I'm talking for the carers and for the healthcare workers that the government should think of increasing their wages. You know, yeah, NHS workers, private workers, private care homes, you know, all of them, the wages should be increased. You understand what I mean? Because it's not fair. I feel like it's not fair at all. You understand what it's not fair. Whenever they are increasing wages to very small peanuts, then they put on top of your wages. They will call a big meeting. They will call a big meeting, but when you go, small wages, then they say, oh, the wages has been increased. We go and look at it. So, is that the one I wasted my time coming here? You know, but what can you do? Yeah, that's what they can do in it. Yeah, so that's what I'm just want to say today. That carers should be appreciated. You know, or healthcare workers should be appreciated, because it's not a easy job. You know, it's not easy job at all. So this is what I'll end here. So take care.